From the moment you walk into the showroom floor at Trap Cadillac, you understand our commitment to providing a truly exceptional experience for all returning and new customers.
Our goal is to make sure you're always comfortable while understanding the entire process of getting into your new Trap Cadillac.
When you drive a Trap Cadillac, you know performance, bold styling, and our shared commitment to service.
One thing you can always count on here at Trap Cadillac is our excellent service experience.
Hello and welcome back to this edition of Bayou Time. I'm your host, Keith Weissite, licensed clinical social worker with Terrebonne Home Care. Very glad you're joining us. However you may be joining us, we appreciate it. And you know, we have some wonderful gems in our community. A lot of those are in the medical field. A lot of us have gotten to know Houma, and Houma is well known for what we provide through our medical community. However, not everybody knows exactly what some of our doctors do. I'm very glad that we have the opportunity to do that today. Welcome, Dr. Logan St. Cyr. Thank you for joining us today.
Thank you so much, Keith.
I appreciate it. And so I am fortunate that I know very well all of the things that you do, but tell us a little bit more about you and how you got here to Houma.
Yeah. Well, I started in Houma. That's the easiest way to get back
that's
here,
right.
So I'm originally from Terrebonne Parish, kind of in between Houma and Thibodaux.
Right.
For people that know the area, Bull Run Road, actually, off of 311.
All right.
So for my training, I started off at LSU. So I went to undergrad at LSU, and then I ended up going away for medical school all the way to Nashville at Vanderbilt. And I specialized in internal medicine, and then I subspecialized in palliative care. Right. And, you know, that's like a 13-year, trip.
Process.
And then I found my way back here, thank goodness. I was eager to get back, and I just got back in around last September and started here.
A year.
Yeah, a year already.
Well, and remarkably, what's happened in that year from what is this subspecialty to, oh my gosh, how did we ever do without it? Right? So tell us a little bit about what you do with this palliative and supportive care medicine, by definition, I suppose.
Yeah, so I can provide kind of like the one sentence technical definition, and then, expand with what that actually means.
Right.
So kind of the one sentence summary is that our goal in palliative care is to support patients and their families and reduce the stress and the suffering that comes along with any serious illness or diagnosis. Now, from all your years of experience that, getting a serious diagnosis, it just turns your world upside down.
Absolutely.
Like it changes everything. And so whenever I say like the stress of a serious illness, that's everything from understanding your diagnosis to getting your meds, to paying for your meds, to having the help you need at home, whether that's equipment, to being asked to make treatment decisions. And then you have all these extra symptoms because your disease makes you short of breath, or you're in pain, or whatever those things are. We try to address all those things and have the time and the bandwidth to sit with families and accompany them and figure out how we can best meet their needs to just smooth this road as much as possible.
Well, you described it very accurately. And interestingly enough, very often when people get one of those advanced illness diagnoses, they have this OMG moment, oh my God, what am I going to do? Because their world stops.
Yes.
Very often they stop hearing at that point. And I know it's one of those things that you and your team try to pick up on. What did they really soak in? And that's where the value of having a team approach comes in, to be able to, all right, we're going to do this with you. We have a team. You're not going to be alone. You won't be on an island. And quite frankly, I think that is the most important thing, because it's the stress. It's that anticipatory stress, if you will. What is this going to mean? How is this going to impact my life? Sometimes the big question is, am I dying?
Yeah.
And that very often is what your team kind of does.
Yeah, that's exactly right. And it's so, because the medical system is a very efficient system, and it does so many things so well. But I think sometimes it's really overwhelming from a patient perspective, because you can just feel swept away. Like all of a sudden you have all these appointments, you have, all these medicines that you're taking. And sometimes people feel like they don't have a voice in the decisions that are being made. And so our job is to make sure that they always have a voice, and that their voice is the first voice that's being heard whenever we're making decisions and figuring out what are your medications going to look like and what is this plan going to look like.
Yeah. And it's somehow preventing them from getting lost, if you will, in this big thing of whatever that is. So speaking of, what are some of those illnesses? What are some of the types of disorders that you treat?
Yeah, I'll say about 70% of my patients have a cancer diagnosis.
Right.
A lot of my other patients have either heart disease or a lung disease, typically like COPD or emphysema.
Right.
I also have patients with either liver disease or kidney disease. And then I also have a small bucket of patients with some neurologic issue, so some brain issue, whether that was a stroke or dementia that's slowly progressing. And often for those patients, you're supporting the family just as much as you're supporting the patients, because it takes a village to take care of someone with an illness like dementia.
Well, you describe it. It's interesting over the course of the years and the joy that I've had in working in Nosotros, one of those support groups that have existed over the years at the hospital. We had one of those people that actually had all of those things, had 3 different types of cancer, then had a stroke, then developed dementia. And so it's interesting that we talk about that kind of person, because you see people with those kinds of complexities, right, who have cancer, and we help them and deal with that, right? And we get over that one hump, if you will, and then a different cancer, another cancer comes back, and then they have a stroke. And all of those things you've got to treat differently, right? And you've got to manage differently. And we're managing the stress that it involves with the family.
Yeah, that's exactly right. And that's why I'm so grateful that I was an internal medicine doctor before I did this.
Right.
You have to be able to see both the forest and the trees, because you don't want to overlook these small details that matter, but you also have to keep the big picture in mind and say, like, I understand we have you on 32 medications, but do we really need all of these medications if they're making your life miserable? Like, you have to weigh pros and cons and look at the big picture sometimes. And making those decisions is done on a case by case basis. And
you just echoed the point of stress of family, right? And if you're on 32 medications and you've got some forgetfulness because of either what we call, chemo fog, or what we call, residual impacts from dementia or cognitive issues from a stroke, then somebody else is having to manage those 32 medications for you. And that can be a little overwhelming. But thank God for you and a team like yours that can help people kind of figure that stuff out. So now's a good stopping point, if that's okay. We're very glad to have you again for another segment, so we can keep talking about your palliative care and supportive programs that you do.
Yeah, that
all
sounds great.
We
Thank you,
appreciate
Keith.
that. All right, guys, we're going to take a short break. Do that with us. Come right back with Dr. Logan St. Cyr as we talk about all of the wonderful things that they can do and the program that they have here in our community. Don't go anywhere. We'll be right back.
Today's social media segment is brought to you by South Louisiana Bank. It's better when we bank together. Waits and Downer, attorneys at law. Terrebonne Ford, built Ford tough.
Hello and welcome back to this edition of Bayou Time. Again, your host, Keith Weissite, licensed clinical social worker with Terrebonne Home Care. Very glad you're joining us, however you may be joining us. We really appreciate it. And very glad to have with us again, Dr. Logan St. Cyr. Thank you again for being here.
Absolutely, Keith.
We were talking a little bit about this team that you have together, and very often we know it takes a village to kind of handle some of these very difficult illnesses and disease states. Let's talk a little bit about the people that you have on this team with you.
Yeah. So whenever the program first started at Terrebonne General, it started with an RN named Melissa Rice, who is incredible. And what she would do is, for patients that had a new diagnosis or a change in their condition, she would spend time with them and their families, really making sure that they understood their diagnosis, that they understood their options, and also just providing emotional support, helping them unpack whatever their needs were. Chantel, an LPN that we have, joined her, and she also has a background in case management. So she's incredibly helpful at, recognizing what needs might arise at home and figuring out how to connect patients with ways to meet those needs, whether that's, they need help with transportation or paying for medications or home health or just whatever those needs are.
Right.
And so I came on as the MD on the team. A lot of what I do is often symptom management. So I can figure out what symptoms they have, and we can come up with a regimen that makes sense for that. But I also consider myself a bit of like a mediator between all the subspecialists, because often things get really complicated, and that kind of needs to be translated and come up with one cohesive plan. So I can talk to all the subspecialists, and we can have a meeting and come up with a plan that makes sense for the patient. So hopefully I can kind of be an ambassador in a way for the patient.
Well, what a unique perspective to have, kind of be in the center of that wheel, if you will, with all these different spokes. And cardiology wants me to do this, and pulmonology wants me to do this, but nephrology says I can't do this. And very often they need someone initially trained in internal medicine to be like, hold on, These are the issues, and this is what may happen if we do this, this, and this. You know, we have these metabolic challenges very often between nephrology and cardiology, right? Just kind of those
all the
written
time.
things. And so we see those challenges, and that's just so wonderful to have somebody be able to look at that and have that extension of your team really helping them understand that. And, you know, the big thing, and I get this more often than anything, when is it time for more help at home? When is it time for home health? When is it time for hospice? When is it time to get more if I can't stay at my home? And those are some of the things that I know you guys are kind of getting to have it addressed.
Yeah, transitions are so hard, and they're different for every person and every family. And
Yes,
so,
yeah.
you know, it takes, like I said, it takes a village.
Truly. So we talk a little bit about the team. What are those services? You mentioned the first one, that symptom relief is really one of those big things that you can kind of help do. Let's talk about some of those other things and services y'all provide.
Yeah. So symptom relief, I kind of mentioned kind of coordination of care. So
Right.
getting all the subspecialists on the same page to come
Right.
up with one cohesive plan. I talked about how our nurses do, you know, emotional support. We also have a chaplain on our team that helps with spiritual support. And then our nurse practitioner does a lot of the same roles that I fill, you know,
Right.
as far as treating symptoms and care coordination. And then something else we do, especially our nurse practitioner in clinic a lot, is something called advanced care planning. Would it be helpful to talk about that just a little bit, or what do you
Absolutely.
think? Okay. So really anyone at any time, you know, something unexpected can happen from a health perspective. And whenever people are really sick, they can't talk to us, right? So often their family is left saying like, what would they have wanted? Like, what would they say right now? You know, would
Right.
they want to be on a breathing machine? How long would they be willing to be on a breathing machine?
Right.
Those really hard questions. And I tell people one of the best ways you can take care of your family is to take that burden off of their shoulders ahead of time.
Right.
You know, on a good day, whenever nothing bad is about to happen, just think about those what ifs and what would be important to you, and we can get them down on paper.
Right.
And your family member can know that ahead of time, so that if ever like a crisis happens, their world's already upside down because they're worried about you, but they don't also have to worry about, are they doing what you would want? Because they
Right.
know, they have the
Right.
peace of mind of knowing exactly what you would want.
It's the value of knowing that La Poste form. It's the
Yeah.
value of knowing advanced directives, and just want people to be comfortable with that, right?
Yeah.
It's sometimes an uncomfortable decision. I'll tell you one personal experience that happened to me as a social worker. My dad had to have a major surgery at 83 years old, and he said, I want to sit down and plan my funeral. Like, yeah, yes, sir. Right? A little overwhelming at first, and then I thought, what a great idea.
Yeah.
If I'm ever going to be a proponent and component of helping people with advanced care planning, this is where it's got to start. And so it was just a wonderful experience. It put his mind at ease.
Yeah.
And quite frankly, it put the family's mind at ease. They knew and know exactly what my dad wants if something were to happen. And that basically is that example of advanced care planning. It's a wonderful approach. It's a little uncomfortable, but once we have that conversation, it makes things so much easier for both the patient and the family.
Yeah. I tell people it's kind of like, you know, having car insurance. You don't pay for car insurance because you're planning on getting in a wreck. But if ever you get in a wreck, like it gives you so much peace of mind that you have insurance and you've already taken care of that, you know?
You've done it. One of those things that people very often are confused by, the myth with regards to hospice and the fact that people think that hospice means somebody is dying right away. Can we maybe describe that briefly?
Yeah. Yeah. I think it's hard because it's one of those things that's in a way like a bit of a vicious cycle, because I think a lot of people have the perception that hospice, you know, comes in whenever you have like days or hours left.
Right.
And because people feel that way, they wait until the very last minute to even consider something like hospice. And
Right.
in reality, the way hospice services were designed is if ever there comes a point in illness, whenever, you know, we don't have treatments that can cure it, and often we don't have treatments that, in all honesty, are more helpful than they are harmful, because we have
Right.
so many side effects to so many of these treatments. If we get to a place like that, then most patients don't want to spend all of their time in the hospital. They would rather spend their time around their family or at home.
Right.
And so hospice is a way that insurance pays for people to get the most possible support at home. So they switch, instead of using their funding for hospital visits,
Right.
they use their funding to get you all the support you can get at home. And so I think, you know, there comes a time whenever it can really give people quality months or beyond months at home, you
Right.
know?
Buddy of mine whose mom went on hospice said there's hospice for the living and hospice for the dying. We need to consider both. So it's really powerful. I want to leave the information, the number 985-873-3484. For people that have seen this, that want more information, they can get that. Dr. St. Cyr, thank you so much for your time.
Yeah, thank
we
you
very
for
much
having me.
appreciate it today.
It's a good day. Yeah,
All right.
thank you.
Very good. All right, guys, that'll do it for this particular segment and this Bayou Time, but don't go anywhere. A whole lot more right here on HTV.
Today's social media segment is brought to you by Alford and Associates for all of your insurance needs. CIS, Cardiovascular Institute of the South, the highest quality cardiovascular care available. Barker Honda, the Barker family tradition of quality.